Are you having trouble controlling your bladder after a prostate surgery? This video is for you. I'm going to show you several exercises that can help you stop leaking after a prostatectomy. A prostatectomy is a surgery that involves removing the prostate and the surrounding tissue, most often for prostate cancer treatment. Unfortunately, though, as many as 40% of people have persistent urinary incontinence after a prostatectomy. So, if you have a prostatectomy coming up, or if you've already had a prostatectomy and you're dealing with leakage, follow along with these 5 exercises and keep watching until the end for 3 specific bladder health tips to get you better faster. I'm Dr. Alex Hill, your physical therapist for everything pelvic health and oncology. Let's get you dry. There are a couple reasons why leakage happens and why it stays persistent after a prostatectomy. With prostatectomies, the prostate is removed as well as part of the urethra that goes through the prostate. Part of the bottom part of the bladder sphincter is removed, and you have a catheter in for a week or 2 after the surgery. All of these factors combined contribute to urinary incontinence. Some other reasons that you might have persistent incontinence is weak and uncoordinated pelvic floor muscles, the type of surgery that you had, if you had bladder issues like leakage before the surgery, and other medical issues like diabetes. These can all contribute to persistent leakage. Exercises focusing on improving the strength, endurance, coordination, and functionality of the pelvic floor muscles can help decrease your leakage and even help with erectile dysfunction that happens after prostatectomy. If you need a little bit more background on what the pelvic floor muscles are, watch my recommended video about the pelvic floor at the end of this video to really understand what's going on down there. A couple of other points before we get started with the exercises is number 1, always check with your medical provider before starting a new program. Number 2, while you're doing the exercises, if you have pain or other unusual symptoms, stop doing them and contact your medical provider. And 3, if you have pelvic pain, definitely check with your medical provider first, because repeated pelvic floor contractions and exercises can sometimes make pain symptoms worse if you're not doing them correctly. The first 2 exercises are focused on isolated pelvic floor contractions. These are often called Kegels. The first exercise is going to be repeated quick contractions of the pelvic floor. So, starting in a seated position, you're going to powerfully contract and pull the pelvic floor muscles in. You should feel the rectum pull in, and you should feel like the penis is getting pulled in, almost like you're shortening it. If you see or feel your abdominal muscles moving, if you feel your butt moving, you're not doing it right, pause and really focus on contracting just the pelvic floor muscles. Because they're on the inside, no one should tell that you're doing them. So let's go ahead and quickly and powerfully contract the pelvic floor muscles and relax completely. Contract and relax. That relaxation part is really important. A lot of times people think about just contract, but being able to fully relax and contract will give you much better functioning. So here we go. Contract, relax. Contract, relax. Good. Up, down. Up, down. Good. 5 more. And 4, 3, 2, and 1 more. Nice big powerful squeeze and relax all the way. So you just did 10 quick contractions. You can do this exercise in a set of 10 and do that a couple times a day. The second pelvic floor exercise that we're going to be doing are repeated endurance contractions. So we're going to start with just a 5-second contraction, and just like with the quick ones, you're going to contract the pelvic floor, pull it up, but you're going to hold it for 5 seconds. And relax for 5 seconds. All right, so go ahead and contract. 5, 4, 3, 2, 1, and relax completely. Now, were you holding your breath while you were contracting the pelvic floor muscles? If you were, try not to hold your breath and just breathe through it. If you're having a hard time breathing through it and you keep holding your breath, Just try counting out loud as you do them. Let's go for number 2. So go ahead and contract, pull up and in for 5, 4, 3, 2, 1, and relax for 5, 4, 3, 2, 1, and contract for 5, 4, 3, 2, 1, and relax for 5, 4, 3, 2, 1. Very good. Now, just like with the quick ones, you can do a set of 10 of these endurance contractions a couple times a day. Once those 5-second holds are easy, go ahead and increase to 6 seconds, 7, 8, 9, all the way up to 10 seconds to really challenge those pelvic floor muscles. Another way to challenge the pelvic floor muscles is don't only do them sitting or lying down. Do them while you're standing, because that's going to be even more challenging for them compared to just lying down or sitting. Now we're going to go beyond the Kegels, beyond just the pelvic floor muscles, and we're going to get the whole body involved. It's time to grab your mat. The next exercise that we're going to do is a bridge. So if you have a pillow or a exercise ball, go ahead and grab that. We're going to be actually putting that between our knees. If you don't have something like that, don't worry. I also need you to grab your mat and let's head to the ground. If you have difficulty getting down to the ground or getting back up, don't worry, you can do this exercise on your bed as well. All right, once you get down to the ground, you can fold your pillow or take your ball, place that between your knees, so you'll have your knees bent, your feet flat, and then what you're going to do is breathe in, and as you breathe out, you're going to pull in and engage your lower abdominals as you breathe out and lift your bottom from the floor. Pause for a couple seconds at the top and then come back down. Breathe in, engage your core, breathe out as you lift, hold for a couple seconds, and come back down. I'll also show it without anything in between the knees. So you're going to breathe in, engage, exhale as you lift up, hold for a couple seconds, and then come back down. Good. Breathe in, engage, breathe out as you lift. Very good. And lower back down. Good. Let's do 7 more. Breathe in, engage, breathe out, and lift, hold it, and come back down. Excellent job. 6 more. Breathe in, engage, breathe out and lift, hold it there, and come back down. Good. Breathe in, engage, and lift. This exercise is really great because you get a lot of bang for your buck. You're working a lot of different muscles, including your lower abdominals, your transverse abdominis, which is a muscle that wraps all the way around the core and it helps co-contract the pelvic floor muscles. It works your back, your buttocks, it works your hamstrings, it works your inner thigh muscles if you've got the pillow or the ball in between your knees. So you really are getting a lot of muscles activating when you do a bridge. Good. And we'll do a couple more. All right, this next exercise is a squat, but don't worry, you don't need to drop it all the way to the floor. Mini squats are a great modification if you have mobility trouble. If you have balance trouble, use a sturdy countertop or table to hold on to for balance. So let's first practice the movement and the breath. You're going to breathe in on the way down and then breathe out on the way up. Let's try that again. Breathe in on the way down and breathe out on the way up. If you're having leakage during the squat, contract your pelvic floor. So, for example, if you're leaking when you get to the bottom of the squat, go ahead, contract the pelvic floor at the bottom and hold it as you come up and you breathe out. So let's do 8 more squats, total of 10. Breathe in, contract, breathe out, and relax at the top. Good. Breathe in, contract, breathe out, relax. Breathe in, contract, breathe out, relax. Good. This is number 5. Breathe in, squeeze, breathe out, and relax. Good. We've got 6, and this is 7. Make sure you're keeping up with that breathing. If you're not having leakage at the bottom, you don't need to worry about doing the Kegel at the bottom. And if you continue to have leakage as you're doing the squats, go ahead and start with just a smaller range. Work on that first until you don't have leakage with that, and then work on getting lower. All right, we've got one more exercise to go, which are lunges. Just like with the squats, don't feel like you have to get super low with these, especially if you have knee pain. If you have trouble with balance, just like with the squats, go ahead and hold on to a countertop or something sturdy to help with your balance. So you're going to breathe in, breathe out as you come forward onto that front leg, and then push yourself back. Switch to the other side, breathe out as you push back. Just like with the squats, if you have leakage as you're here, right, this is going to stress the pelvic floor muscles more. Go ahead and do a Kegel. Really exhale as you come up to activate the pelvic floor. Engage that lower abdominal muscle, pull in. That can also help with decreasing the leakage. If you need that support, go ahead, use it. Otherwise, we're going to lunge forward, breathe out as you push back, breathe in, breathe out. Good. This is 2. We're going to go for 10 on each side. Start out with this exercise doing it just without any weights. As those muscles get stronger, you're having less leakage, go ahead and add some weights to it, but you don't need to add a lot of weight to these. We're working more on the coordination of those pelvic floor muscles activating as you're doing these more functional movements. We're working on your breathing, making sure that you are not holding your breath. Very good. And we've got 3 more after this one. We've got 3 and 2. Good, you're almost there. If you feel like your muscles are getting fatigued, slow down the movement. Make the movement smaller, okay? We want to work on progressively loading those muscles. Very good. Now that you've made it through the exercises, I'm going to tell you 3 specific tips to further decrease your leakage. Number 1 is going to be doing something called the knack. All this is contracting the pelvic floor muscles during exertion. So, for example, when you cough, when you sneeze, when you laugh, when you go to stand up from the couch, any activity that you have leakage with, contract the pelvic floor muscle as you do it. So you're going to squeeze, cough, and then relax. Let's go ahead and practice that. Breathe in, squeeze, cough, and relax. Good. Let's try it one more time. Breathe in, squeeze, cough, and relax. So doing the Kegel as you cough or exert yourself is going to help with actually closing off the urethra and supporting the urethra and bladder so that you don't leak. Next is avoiding bladder irritants, especially if you have a lot of leakage or you're having urgency. Bladder irritants are foods and drinks that are carbonated, spicy, acidic like orange juice or tomato sauce, and alcohol. More water and less of these irritants will keep your bladder happy and less irritable so that you leak less. Finally, time when you go to the bathroom. It's easy after a prostatectomy to frequently go to the bathroom and try to avoid leakage, but this does your bladder no favors. After having the catheter in, after surgery, the bladder needs to relearn to refill completely and give you the proper sensation and trigger that, yes, I'm full, I need to go to the bathroom. So if you're drinking enough water, your pee should be the color of like a light lemonade, and you should aim to go to the bathroom every 2 to 3 hours, so set a timer for yourself. I hope this video was helpful in helping you heal and decrease your leakage after your prostatectomy. Make sure you subscribe to my channel for more tips on prostatectomy and pelvic health healing.